Representative Howard had a question.
Yes, ma'am.
Thank you, Mr. Chairman. I want to just go back to what you said real quickly.
Yes,
Dr. Bonham's head here. Thank you.
Sorry, Mr. Bonham.
I want to make sure I heard you. Thank you so much. I heard you correctly. You're saying that if we did the expansion, that even in 2014-15, that we would free up an additional, what was it, $1.2 billion?
Well, I mean, obviously, this committee and the Senate Finance Committee would determine how much that number actually is. What we did was look at the legislative appropriation request, and I hesitate to go down this list for the Medicaid Pregnant Women's Program, the Women's Health Services, Breast and Cervical Cancer Program, and what we tried to do was to estimate the portions of those programs that would go under the Medicaid program. So,
which I think
freeing capacity.
When LBV was here earlier, they were indicating that they had only assumed the medical breast and cervical cancer program clients. They didn't look at all those other programs that might have offsets. Is that
well? I mean, I think we're all at different stages in the. I think the one point that clearly has been made to the committee today is this is a complicated issue, and
but I do want to just clarify that you are saying that
yes,
your
and we'll provide
LARs
that information. Yes, ma'am.
And we would have a freed up additional $1.2 billion using your methodology.
I believe
that could be used on public education, water projects, whatever we chose to. But
yes, ma'am.
And it would be within the spending limit.
Yes, ma'am. I believe. Now that again, the control agencies always get the final say.
Thank you. I just wanted to clarify that's what you said.
Yes, ma'am.
Hey, Billy, can you wrap up?
Yes, sir, I can. There's one final, I think, important point. One of the issues that's come up about this is the continuing issue that there may be local savings or relief to local hospital districts and counties as a result of this program. We actually have looked at that issue, and we believe that there will be. We haven't got we've got these broad estimates, but nothing more important. But we have looked at mechanisms that would make it possible, if the legislature chose to do so, to roll back local property tax rates for hospital districts and counties if the legislature chose to partially offset the savings from this program. Obviously, it would be partially because otherwise there would be no incentive locally. But that is a possible mechanism. There's an indigent health care adjustment in the property tax code now in the truth in taxation calculation. I think it's an enormous challenge for the legislature, and we appreciate the opportunity to talk today.
Thank you, Billy.